Good afternoon. My name is Priscilla, and I am the Associate Director for the Office for Advocacy and Violence Prevention. Joining me today is Amanda, of course, from our University Police Department Victim Services Unit. And our topic of conversation today is building a bridge between law enforcement and mental health. Oh, sorry, my PowerPoint. There you go. Some objectives for today, what we want to do is, of course, gain an understanding of how law enforcement and mental health agencies work together. Of course, to recognize the importance of understanding the mental health and the system of what people have to deal with. And of course, to identify the resources available in our community. And we do want to give a disclaimer trigger warning. The content of this presentation and discussion could be troubling, especially for survivors of violence victimization or harassment. Please feel free to leave if the discussion triggers an upsetting response. Please treat this session as a safe space and respect the boundaries of others, especially if their views or experiences are clearly troubling to them. So joining us today is Cesar Liscano, FAR PD Mental Health Officer, and Mike Dominguez, Tropical Texas Behavioral Health, from Tropical Texas to Behavioral Health. If you all want to introduce yourselves really quick before we begin, and I turn this over to Amanda.
Yes, hi. My name is Officer Cesar Liscano here with the FAR Police Department. I am a mental health officer and I've been in service for 15 years.
Yeah, my name is Mike Dominguez. I work for Tropical Texas Behavioral Health in the MCOT, which is Mobile Crisis Outreach Team. I had been in that department for a couple of years. I've been working in mental health and intellectual developmental disabilities for more than 15 years. So Tropical Texas Behavioral Health was able to create a contract with FAR Police Department because the FAR PD chief is very progressive and forward and wants to get things moving in the right direction. So they created a mental health unit, and I was transferred or basically contracted out to FAR Police Department. So I'm housed here Monday through Friday, 8 to 5. I'm here full time. And yeah, I work with Liscano and a couple of the other mental health officers out in the community.
Well, thank you for joining us today. And now I'm going to turn it over to Amanda, who's going to continue our conversation. And, oh, wrong mouse. And there you go. Go for it, Amanda.
Awesome. Thanks, Priscilla. And gentlemen, thank you for joining us. July is Minority Mental Health Awareness Month. We're very grateful that the FAR PD Mental Health Unit is here for a water cooler conversation. We do want to tell our audience that we might go a little bit over the 30 minutes just because there is a lot of great information. So we are going to just jump right in so we can get started. Okay, guys, you ready?
Yes. Yeah.
Awesome. So what is the FAR PD Mental Health Unit? And how does Tropical assist with this unit?
Yeah, so kind of like what I said, Tropical Texas Behavioral Health has had the Mobile Crisis Outreach Team. And so what MCOT does is we get called out for mental health crises. We go and talk to people, we identify the situation, and we help de-escalate and refer them to the most appropriate services. Similarly, the police officers, FAR Police Department, or most departments, they have a job to make sure that people are safe at the end of the day. Their job is not to just run around arresting people and giving tickets. They have a duty to protect. They have a duty to help others, and so they do that already. And so working together, and I'm sure this is going to be another question that's going to come up, but working together, we're here to try to bridge that gap, which is a perfect topic for this discussion.
Awesome. Thank you.
Yes, to add to that, I do want to read our mission statement for our Police Department Mental Health Unit. So the mission of the FAR Police Department Mental Health Unit and Crisis Intervention Team, CIT program, is to develop partnerships with mental health consumers, their family members, and other mental health agencies and organizations to better serve the mental health consumer in crisis. Mental health officers will respond to individuals who are in crisis as a result of a mental health disorder and shall assess and assist those individuals most effectively and compassionately possible. Mental health officers shall utilize their training to remain sensitive to the needs of the mental health consumer, always displaying the highest level of professionalism.
Awesome. Thank you so much for reading that. We appreciate it. Now, how many officers are in the unit and how many clinicians?
We have there's a total of 15 officers that got certified with the additional 40-hour course for mental health officer. That's an additional 40 hours of training in CIT. And basically, in the unit itself, there's 3 patrol officers I'm sorry, there's going to be 3 officers, which is myself, Officer Jacqueline Rodriguez, Officer Nicholas Cepeda, and 1 sergeant, and of course Mike, which is a clinician with Tropical, Texas. Yes.
Okay, awesome.
And to kind of tag into that, the 15 officers that were trained, the chief could have just had the 3 trained that are designated to the unit, but he decided to train a lot more just because the opportunity presented itself, and he wanted that to happen. And so, Officer Liscano, as well as Nick and Jackie, they're dedicated to the unit, and the other 12 officers are sprinkled throughout different shifts.
Nice.
So that, at any time, different departments, I think we have some investigators that are trained in mental health. We have patrol officers that are trained in mental health. And so if there's an officer that doesn't really know how to approach, there should be another officer somewhere around that can try to assist in the event that we're not available. For the most part, we try to jump in and do everything that we can. But it's good to have officers prepared.
Most definitely. That's awesome to hear. Now, Liscano, you mentioned CIT. What is CIT?
So CIT is considered crisis intervention. So
Thank
we are
you. Okay.
trained. So the state mandates every peace officer to be trained in CIT. And
Got it. Okay.
I want to say that that's nationwide, and here in the state of Texas, we do have a mandate for 40 hours of CIT training. The type of license that we have, though, as mental health officers, that's an additional 40 hours of training that we have to get in order for us to get that license as a mental health officer.
Okay, so the officers in your unit do have to have the 40-hour training, which is the CIT. Now, what about like other agencies? Are they also participating or doing these kinds of trainings as well? Or is it just FAR PD?
So the other agents have to have mandates as far as the 40-hour CIT course, because it is mandated by TICO, which is the licensing regulation for police officers here in the state of Texas. And the additional training, that's more of a specialized training for officers.
Okay,
and
for a particular unit.
Correct. Yes.
Okay. Okay, cool. Now, the collaboration between Tropical and FAR PD, how long has this been in existence?
So Tropical, Texas, I guess there was a conversation between Chief Harvey and Tropical, and they kind of approached it because this isn't the first of its kind. There are other co-responder style programs in many other areas, primarily larger cities, but this is the first of its kind in our area.
Right.
And so we have a lot of small cities, the Rio Grande Valley. If you put it together, there's a lot of people and in a lot of cities that are really connected. And so Chief Harvey, wanted his officers to excel and to be available and provide the best services that they can to the community. And so between Chief Harvey and Tropical, Texas, they went ahead and had this conversation for, I'm assuming, a period of time until they finally got it situated. And we got this started in January 1st of this year. So we're a little over 6 months going, and we've done so much.
I would imagine.
We hit the ground running. I know the CEO said, we're going to build this plane, even if we got to build it while we fly it. We're going to work it. And that's what we're doing. There's a lot of, this program is very new. It's not common in the Valley, and it throws people off sometimes. And to see an officer show up with a counselor, and it's one of those things that we have to really just talk to people and bring it down a level and just tell them, look, aside from him being an officer and aside from me being a counselor, we're here because we care, and let's talk.
That's awesome. That's so good to hear. Now, I know you all are the first ones that are doing it here in the Valley. Of course, it's in other cities, like you mentioned. Are other police departments here in the Valley kind of looking to you all for guidance, maybe to start their own unit?
Yeah.
Oh,
so
nice.
We've actually we get out there too, and we try to recruit other departments. So right off the bat, we'll have other departments during meetings, during different situations. We end up talking to lieutenants, sergeants. We talk to chiefs, assistant chiefs, and just kind of bring them into discussion. They have questions about what we do, and we're more than willing to open that topic.
That is great.
there's some departments that are a little bit hesitant, or a lot hesitant, because of the cost, or they don't have as many officers, or there's different situations.
Of
And
course.
so one of the things that we try to explain is that we don't expect all police departments to do exactly what we're doing. We hope that they can at least do something within their means.
But
And
you're giving
so
them the bullets to try to figure it out on their own,
exactly.
right?
And
Mhm.
so like we I know another department, they were struggling with a particular case, got a little bit complicated, and we found out about it afterwards.
Mhm.
And I reached out to the sergeant. I said, hey, you know what? I heard that this was a particular situation. I said, I understand that you're a smaller department. Do you want to schedule a meeting? Let's sit down and talk. Let's identify what
Mhm.
are y'all's strengths, what are some limitations that you guys have, and let's brainstorm and figure out a way to help you develop a more efficient system, or something that's a little bit more streamlined for them.
I love the fact that you all are willing and able to help out other agencies, because that's what it's all about, the collaboration and the working together for the better of our community.
Yeah.
Now, obviously, people throw the word crisis around a lot, and to one person it might mean something, to somebody else it might mean something else. What exactly would consist of a crisis for you all to have to be called? Like, if somebody has a crisis, do they call tropical? Do they call the PD? What should they do?
So a crisis is, in my opinion, it's very subjective. You know what I mean?
Mhm.
A crisis to one person may not be a crisis to many other people. And one of the things that we started doing is that, when we started this program, I come from a department that all I do is crisis.
Right.
Whenever we get calls from hospitals or police departments because there is a mental health or medical crisis, and so we go in already knowing that that's what it is. Ever since I came over here to the department, I noticed that we get calls from FAR PD dispatch, and patrol may have gone to a home. There was a disturbance there, arguments, whatever it be, and they call us out because there's some sort of concern, and there's mental health aspects in it. So instead of us just going over there thinking it's a full-fledged crisis, that everything is chaotic, the way that the word sounds,
Right.
we just go in and talk. We go in and see, okay, so
Conversation.
what is going on? How can we be of assistance? And a lot of times, just talking resolves a lot of the situations. And so instead of treating everything like crisis, it's more like it's a call.
I
Let's
like that. Mhm.
let's just go. You know what I mean? We don't know until we show up. And you know how telephone works. Somebody says something on the phone, and then the
Yeah.
other person says something else, and then somebody says something else, and by the time you know it, it's just blown out of proportion, and it wasn't that complicated. So rushing in thinking that it's chaotic is not going to help the situation.
Very true. Very true. So a lot of the times people with, underlying mental health issues, they might not even have a diagnosis and they end up in the system.
Yeah.
Let's say Officer Liscano, he's been in this profession for a long time. So he's probably gone to a lot of the calls, right? That could have benefited for something like this. So do you feel that this unit has been helping in the past 6 months or so that it's been in progress? Do you think that it's helped to maybe help a person, instead of going to jail, that they're getting treatment, or they're on a treatment plan? What do y'all think?
Absolutely. Yes, most definitely. We take a different approach, like I read earlier, that we
Mhm.
take an approach of a more compassionate manner. We're there to listen, first of all, and like mentioned, I mean, every case is different. It's a case by case, but you know
Most
what? We're
definitely.
there to listen, and we do take a different approach. A more compassionate approach. And yes, absolutely, man.
I like the fact that you said that the compassion, because I feel that it's what it comes down to: compassion and empathy, not just, jumping the gun and trying to, get the bad guy, because that might not even be the situation. So you feel that this has made a difference in the past couple of months. That's awesome. Now, what would be, though, some of the requirements for somebody to be hospitalized at a behavioral center? What would be the process for that,
So
if it does come to that?
the legal aspect would be if the person is an imminent risk of danger to themselves or others,
Okay.
then that warrants an assessment. Not necessarily that they need to go to a hospital, that
Mhm.
warrants assessment. And so that's what we do. There's instances where patrol will go out, they're in the community, they see somebody that's actively trying to harm themselves, or they straight out tell them, I don't want to live anymore, and that they have a plan and they were about to do something to themselves. Patrol is able to take that person under their custody for a mental health concern,
Mhm.
and try to get assessment or try to get an evaluation to see, okay, what can we do from here? And one of the things about this unit is that I'm the one that does the assessment.
Right.
traditionally through tropicals. So the fact that I'm already here to do that for them makes it so much easier, because there's instances where sometimes, like I said, telephone, patrol hears all these things on the phone, they go out, the person says, no, 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 everything's fine, but you don't know if there is actual risk, and the officer is
Right.
basing it off of, what he's heard. And
Mhm.
so it takes a lot more to really understand the situation to determine if they do need to go to a hospital. Because what we need to do is help the person in the least restrictive means possible. So hospital being a restrictive means, if we can avoid it, we're not going to do a hospitalization.
Mhm.
If it's something that we can assist them through an outpatient form, they have family support, the family's able to say, hey, you know what, I can take care of them, I will watch them, I'm going to make sure they get to their appointments, and we go do a follow-up. That's it. You know what I mean? There's no need for a hospital. And I've done that before in the past, where somebody's voicing some concerns, and we go the outpatient route. There's some risk, but there's
Right.
a lot of support. There's a lot of factors that's going to make sure that they're going to be safe. And after maybe a week or so, if that person, is still presenting with the same situation, or it's a lot worse,
Mhm.
and hospitalization is an option that they're willing to accept and allow us to help them with, then we'll help get that going.
And again, it's a case by case.
Exactly. There's
Exactly,
so
which is
many
so important to
factors.
note.
Yeah.
Yeah. Okay. Now we hear we used to hear Section 28, Section 26, and now, as Liscano and I were talking about it the other day,
Yeah.
they're referred to as emergency detention.
Right.
Can you all explain what those are so that people can be aware of, and then who implements them?
Yes, absolutely. So, hey, Section 26, which is an emergency detention, that's a apprehension by a police officer without a
Okay.
warrant, meaning that it's going to be an involuntary, I guess, assistance for the individual in crisis, whether it be that they have suicidal ideations, mental deterioration, or they want to hurt somebody else, a third party. So that's when we could implement the emergency detention.
Okay.
Under the Texas code, it's going to be the Texas Health and Safety Code 573.001, which is apprehension by a peace officer without a warrant. And
Okay.
Section 28, that's a mental health warrant that's normally signed by a justice of the peace. And it's a warrant so that we could apprehend an individual who might benefit from mental health evaluation, because potentially they need further services, or they could be going through the crime. Yes, well, the emergency detention, that's what a police officer does when he feels that the person is in danger of themselves or others, when it's gotten to that point where it's become a crisis already.
Right.
He'll implement that. Now, just mind you,
Mhm.
we try not to place those, because we don't want to take somebody's rights. But I mean, we have to assess and make sure that that person is safe, because we do have a duty to protect,
Right.
and we'll do whatever possible we can to talk to the individual and try to provide services, But if it's a crisis, we're gonna have to put that emergency detention order on an individual. We will.
Got it. Okay. But let's say that a person, okay, they do have rights, and they do end up having to be detained and admitted to behavioral hospital. What happens if they don't want to go? And what happens if it's a child and not an adult?
So it gets a little bit complicated. Like I said, there's so many different factors. And
Right.
depending on the
At
age of
least
the
try to give
child.
us one example so we could get
So
an idea.
I have an example. One of the
Mhm.
younger kiddos that I've sent over that I absolutely did not want to, and I'm not going to go into detail, right?
Okay.
So I had a young one. I try not to send kids into the behavioral hospital if it's not necessary, because there's supports available. The
Mhm.
parents can watch them. But I worked with a young one, and I could see that he was struggling. He had a lot of really strong emotional pain based on something that happened.
Mhm.
And I talked with him, and I kind of took a little bit extra time, and I tried to counsel him a little bit. And his mom was present. It was at a school. He had an outburst, but there was more to it. And so I talked with him, and I try to work with mom, and I try to explain to him a little, help him understand a little bit more. But at the end of the conversation, he just 100% says, I have intention to end my life because I am so hurt because and this and that. And he was very resentful towards mom, even though it wasn't her fault, but he didn't understand that because he's really young.
Right.
And the level of intent that he displayed for his age is not common, you know, and it's mom alone. She's the only one to watch over him. And he's not just throwing a tantrum, he had real emotional pain. And his level of understanding towards not wanting to live was way too strong. So I told mom, you know what? In this particular situation, you can't watch him every single waking moment. You're going to have to go to sleep eventually. And this
Right.
kiddo really needs to process what's going on. So in that instance, mom was not in agreement, you know, with the plan, but there was a high potential that this kid would have done something to hurt himself. And all it takes is a second.
Most definitely. Yeah.
It only takes a second. And so in that situation, I had to send him in, and I did not want to. It was the last option, but it was necessary.
Wow. My goodness. Now, I'm going to switch it over back to Liscano. We've heard welfare check. Oh, we'll do a welfare check. What is that? And who calls for them? How do those work?
Oh, basically, a welfare check is for a police officer to go out to somebody's residence or employment anywhere, you know, where the person might be, to just have a welfare check on them because of concerns of maybe medical or mental health. And basically, what the officer does is that they go out to the location and just have a check-in on the person. That's basically
Okay, that's basically what it is. Okay.
We had one earlier. Literally this morning, we got a call from, I guess you can say an employer, obviously for confidentiality. We had a call from a particular employer, said that they were concerned for their employee because they hadn't reported to work in a couple weeks, and they heard reports that he was posting things on social media that were concerning. And so, you know, we went out to the residence, we knocked on the door, we knocked on the window, we waited around hoping that we can make contact to make sure he's okay, but there was no contact made, no answer, no nothing. Thankfully, our sergeant was also helping us on that one. He made contact with the gentleman over the phone. You know, he said that he's fine and that, you know, he's with his family, everything's fine, denied everything. Regardless of the fact, we're still going to follow up again.
No, that's good. That's important.
Because you don't really know. It's easy for somebody that's in pain to say, I'm fine, I'm fine, I'm fine, which is the most common response you get. I'm fine.
Exactly.
And they're not. And so we add people to kind of a list. It's not a formal list. It's just, you know what, we need to go check on this person. We haven't talked to them in a while.
A little check-in.
Yeah, and that's what we do. And we get really good response on that.
That's good. That's so important. I'm going to go back though real quick to that. We were talking right now about that story that you don't want to go into too much detail about the student or the little child. But what happens though if the parent disagreed?
So the mom has, she does have rights to not allow her child to be admitted to the behavioral.
Okay.
Now, because the child was placed under an emergency detention order by one of the officers that was present at the time, this is before FAR. You know, this was a long time ago. And you know, the officer also noted how intense this child's emotions were. And, you know, he understood what I was talking about when I explained it to him a little bit more on the clinical side. And so he placed a detention order. Mom wasn't happy, but we told her, Mom, you can come. Basically, the officer told her, you can come with me. Let's go together so that you can stay with your child. Let's go to the behavioral. I need to get you there, and I need to get him seen by, you know, preferably a psychiatrist. Now, if when they arrive, mom refuses treatment and she does not want him in, then she can technically sign him out. However, because she's potentially putting her child at risk, then CPS would need to get involved to verify that that child is going to be okay.
And to add to that, the emergency detention, I want to read something as well.
Okay.
Basically, this applies to the emergency detention as far as rights. So how long can a person be in a facility on a Texas peace officer notification of emergency detention, which is like we mentioned earlier, Section 26, right?
Right. Okay.
A person accepted for preliminary examination may be detained in custody for not longer than 48 hours after the time the person is presented to the facility, unless a written order of protective custody is obtained. The 48-hour period includes any time patient spends waiting in the facility for medical care, before the person receives the preliminary examination. So there is 48 hours unless there's an order of protective custody, and typically a psychiatrist or a doctor would request that from a judge based on their opinion of the individual, whether it be mental deterioration or harm to self or others. And if a judge does grant that, then the patient could stay longer.
Okay. And at the end of the, go ahead, I'm sorry.
By order of the judge.
Right. And at the end of the day, you all are just trying to keep that person safe and those around them safe. So
Correct.
And
goes
that's the
without
thing,
saying.
that, yeah, law enforcement officers are very good at identifying risk. They have to. That's their job.
Exactly.
I'm trained to identify risk on a clinical level. That's my job. That's what I'm trained to do. And so a lot of times we see risk factors that the individual and the families don't see. And so
It's true.
and the difference is that we've actually had good responses from families because we will take the time and explain, this is what we see, this is our concern, and this is a likelihood of what may happen, and this is why we're going through this particular process. And they're a lot more responsive, because if you don't take the time to explain, then they're not going to accept or want the help because they don't understand.
No,
And
it's
so-
totally true, because Priscilla and I can tell you the same thing, where we'll go over, just an example, a safety plan with somebody and maybe speak a week later and they forgot everything, but that's okay. We'll just review it. We'll go over it again, because it's all about the communicating.
Yeah. And
Yeah.
so, like, for example, just yesterday, we try not to place a detention order if we don't have to. And if there's someone that actively wants the help, they're calling for help, they're open to anything, let's give you a ride to the behavioral. There's no need for a detention. There's no need for anything. Hop in the unit. Let's give you a ride like a taxi and just get you to behavioral. Check yourself in voluntarily.
Yeah.
And if you feel that after some time you're not comfortable here and you want to leave, you have the right to leave. You're not detained. And that really opens up people to wanting the help, rather than forcing help on them that they don't want or that they're scared of.
Yeah, they want to have a say in what happens to them.
Yeah, and giving them the power over their treatment
Exactly.
is what really helps. And that's what reinforces that bond that we have, that we develop the rapport with the clients, so that they're okay with us going back. They're okay with us having a conversation. You know, just because we show up doesn't have to be any particular thing. Let's just talk. That's it.
Yeah. And sometimes that's all of us need, somebody to talk to.
Exactly.
Right. We are running out of time, but I do want to throw in a couple more little talking points really fast. What is the mental health court? I know I've heard of it before. I just want you all to just touch a little bit on that.
Basically, Hidalgo County has a mental health court. It goes through the, if I'm mistaken, it goes to the probate court. And basically what they do is that they screen, you know, for some of the cases with mental health consumers that are incarcerated. They'll move their court case to the mental health court and try to get them assistance and services. Basically, I believe they do have a partnership as well with the local mental health authority, which is a Tropical Texas Behavioral Health.
Okay, awesome. Good. Now, we are going to have to, come to an end, but before we, move on and talk a little bit about resources to our audience, is there something each of you would like to say to those viewing about your unit, or just about anything in general having to do with mental health?
Ask for help.
Yeah,
Literally.
Ask
for help, and don't give up if you don't get the help that you need the first time, because it's unfortunate. We just worked with the person that we took yesterday for voluntary admission. We had already worked with her. She had already displayed a lot of risk, but she was petrified of the mental health of inpatient hospitalization because she had a really bad experience when she was younger. And so instead of us forcing that on her right away, there was other support. And so we tried the outpatient method. We really did. And it was unfortunate for her, because everyone that she called, she kept saying, we'll call you back. We'll call you back. And she got nowhere. She was hitting walls. She was falling through the cracks. She called us back and says, I don't know what to do anymore. I've tried. Nobody's getting back to me. So we went over there to her house. She allowed us to go over there. We sat down. We talked, and we told her, look, we tried not to do inpatient, out of courtesy for you, because we don't want to cause you more damage. However, what you went through a long time ago was very different. It's a totally different situation. Right now, you're in control because you want the assistance. So allow us to take you to get that help. And she did. And we took
Oh,
her
that's good.
voluntarily, and she has power over that admission. She has power over her services. And so resources are very important. Go the extra mile, assuming that you guys work in, whether it's a helping field or any kind of field,
Mhm.
go the extra mile, take that extra step and help them get connected, because you could potentially save their life just helping them make sure that they get that appointment. It can be as simple as that. I had the phone call with her when she was the first time when she was really distraught. I did a 3-way call while I had her on the phone. I did a 3-way call to her employee assistance program. I got her authorized for 5 free counseling sessions and got her connected with a counselor. It wasn't enough because I already knew that she needed more. I just
But it
didn't
was a
want,
start. Yeah.
and it was a start.
Yeah.
And
Opening that
fell-
door.
and even that fell through for her, which was really bad. And I felt horrible about it. But I mean, at that point, all I can do is help her further, help her past that situation. And so
Right,
we're going to
exactly.
continue to follow up with her as soon as she's out of the hospital and she's open to it. And resources are important. One of the things that we strive on doing is sharing resources, because if people don't know who to call, they call 911. And officers are not counselors.
Yeah.
You know what I mean? So that's why we do what we do, is because he has strengths and he has things that I can't do. I have strengths and things that he can't do. And so until we learn each other's strengths and weaknesses is the only way that we can bridge that gap, which is exactly the topic that we have right now.
And also,
Yeah. And yes.
if I may mention something else as well, is that
Yes.
through the police department, we are also advocates to law enforcement agencies. So we do have an alliance that we have. We have monthly meetings,
Mhm.
and basically what we do is that we invite organizations so that they could share information to these law enforcement agencies, so that we could network and learn more. Because I know there's a lot of resources out there, and it's important for these law enforcement agencies to understand that there is resources out there aside from your local hospitals, of course.
Most definitely. Oh, awesome. Thank you. So it really does take a village. It does. It's all about that. Thank you. Here are some of the university resources on campus for any of our students, staff, and faculty if they need assistance. And then we also have our community resources, of course, with counseling, tropical phone number, NAMI, and our counseling centers on campus as well, and our psychology clinic, and some additional resources, whether it be a shelter or a hotline. This is a very important topic. We are so grateful to both of you for joining us today to close out the month for Minority Mental Health Awareness. And again, to all of you all participating, thank you for taking the time. And also take care of yourselves, take care of your mental health, whether it's for yourself or somebody else. Like they said, there are resources, and sometimes it can feel defeating because nobody calls you back, but there are people that are willing and able to help. Priscilla, you want to say anything before we come to an end?
No, I just want to say thank you, Mike, and thank you, Officer Lizcano, for joining us and taking your time. I know you all are very busy, as you can tell, because you're in your unit right now. But thank you for taking the time to talk to us and bring up this important new unit that you all are trying to are collaborating and getting out there to the community. I know I've seen you all around the FAR area advertising your services, and I've seen the work that y'all have done. That's been, of course, come out in the news and stuff like that. So thank you for joining us. Thank you, everybody, for joining us.
Yes.
And see us.
Thank you guys for coming in.
Thank you.
Thank you,
And our
guys.
next water cooler will not be until the fall semester because we're still working on that. So keep an eye out on Messenger and on different areas on the different topics that we'll be discussing coming up in the fall.
Awesome. Y'all be careful, be safe, and we'll see you in the fall.
Thank you.
Y'all have a good day.
Bye.